Welcome to Accent on local Christian radio, KJOL.
And I'm your host, Dave Andrews. Dr. John Koval is a radiation oncologist who specializes in radiation therapy for cancer patients. And as the month of May is National Skin Cancer Awareness Month, he speaks with us about decreasing the risk of skin cancer.
Well, yeah, it's Skin Cancer Awareness Month, and I think everybody in the country should become aware of the fact that skin cancer is very common. It's increasing in frequency, and they should learn the things to do to try to decrease the risk of skin cancers.
Now, I understand that this cancer is not as dependent upon genetics.
That's correct, except for melanoma. Sometimes melanoma can run in families, but primarily it's related to sun or UV light exposure.
Okay, how about some precautions we can take?
Well, I think we have to try to limit our exposure to the sun or indoor tanning as much as possible. And if we have to be out in the sun, to take the right precautions with sunscreen and cover up and sunglasses and hats, so that over the years we don't overexpose our skin to UV light that can cause skin cancers.
So I understand that the older population is not the only folks at risk.
It's much more common in people who have been exposed to the sun or been out in the sun for years and years and years. But the incidence of, for example, melanoma is increasing, particularly in young adults who get exposed to the sun for tanning purposes or indoor tanning when they're in their late teens, early 20s. And the rate of melanoma, which is the deadliest of all skin cancers, is actually going up. And I think that can probably be prevented if people take the right precautions.
Thanks for joining us for Accent. Be sure to listen weekdays, Monday through Friday at 6:30 a.m., 2:30 p.m., and 5:45 p.m. on KJOL, where you hear the light.